Oh, thank you so much, Rabbi Siegel. That was touching. And I wish I had a Zoom background as cool as yours. I'm going to have to steal it.
I'll share it with you.
Yes, please. With that, let me share my screen. And can everyone hear, if you can hear me okay, just put a thumbs up. Excellent. All right. Well, as Rabbi Siegel mentioned, it's an honor to be with you tonight. I'm a member of the shul, and I can't thank Rabbi Siegel and Amy enough for helping me and for helping to put on the event, and also for everyone who's attending tonight. And I can see I know some of you very well. A special shout out to my mom who's joining the presentation from work, and also to my in-laws because I have to be nice to them. Anyways, my name is Ari Parker, and my goal is to help people make better choices around Medicare. And this is me with my three angels, my wife Molly, who Rabbi Siegel mentioned. She attended Bernard Zell, her grandmother, Nani, and my Nana, who's also here tonight. And as a collective, I refer to them as Ari's Angels. I'm sure that many of you know Marilyn, Simon, and Molly, and they've been members of the Anshe community for decades. And as Rabbi Siegel mentioned, I joined in the past year, and I couldn't imagine a more welcoming community. Anyhow, I'm the lead advisor at an organization called Chapter, and it serves thousands of adults every year free of charge. Ultimately, what I want to leave you with tonight is to make sure that you're empowered with the knowledge you need to sort through your Medicare options. And that's my goal in hosting today's presentation, and it's a purely educational one. So I expect that you'll have questions along the way. Please put them in the Zoom chat, and we should have time at the end for Q&A. And I'll also mention that every week I write on healthcare policy and in some technology tips and general social recreational. And if you'd like to sign up for my newsletter, the Chapter newsletter, then you can just put your name and email address in the chat and you'll be added because I'll save a copy of it to make sure that you're part of it. And there are also changes that you should know about Medicare. So it's a really helpful source if you're looking to learn more about Medicare. So just put your name and email in the chat if you'd like more information on it. With that, there are 4 things that I'm going to address this evening. The first is I'm going to provide a broad introduction to Medicare. The second is I'm going to introduce a fusion of 2 types of clients from your community that Chapter has helped, Ronald and Linda. Third, I'll walk you through the 3 critical decision phases that most adults will go through as they choose their Medicare. And finally, I'm going to share the 5 most common mistakes I've seen clients make because I want to make sure that you avoid them. And here's a New Yorker cartoon I enjoyed. I can't tell if it's a politician or a Medicare advisor. You can be the judge, but Medicare can really sound like gobbledygook, and I think this does an excellent job expressing that. If you feel confused, you're not alone. The system has been built patchwork, which has created a lot of complexity, unnecessary complexity, and that's why I'm here to break it down for you tonight in a simple, straightforward manner. So subpoint A, the who and not the band, it's a question of who qualifies for Medicare in the first place. If you're not yet 65, then you can still qualify for Medicare actually, and many people don't know this. The way that you would qualify for Medicare if you're not yet 65 is if you have Social Security disability benefits for at least 24 months, and having that period, it's okay if that period is non-consecutive. It doesn't have to be a strict 24 months start to end, but it does need to be 24 months in aggregate. The other way that you can qualify for Medicare before the age 65 is under 2 circumstances, which are very serious. The first is if you have Lou Gehrig's disease, and the second is if you have permanent kidney failure. And if you're questioning whether you have permanent kidney failure, you likely don't have it because it's actually called end-stage renal disease, which is a medical classification. So you would likely know if you were to qualify for end-stage renal disease, which is what is required, one of the ways in which you can qualify for Medicare before the age of 65. The other way to get Medicare, which applies to the vast majority, is that you're turning 65 and you meet 2 conditions. The first is that you are a US citizen or you're a permanent legal resident. So you don't actually have to be a US citizen. But if you are a permanent resident, then you must have lived in the United States for at least 5 years. And this is a condition too. You must have paid Medicare payroll taxes for 10 years, or which is about 40 quarters. Actually, it is 40 quarters. Or you've been married to a spouse for 10 years or greater who is paid into the system. So that's the way that you get Medicare. You're either a US citizen or permanent resident for greater than 5 years, and you've paid into the system. And if you haven't paid into the system, then you should talk to me afterwards, because there's still a way that you can get Medicare. It's just going to cost you something because it hasn't been deducted from your payroll taxes. Then subpoint B is, what does your Medicare cover? Well, there are two parts to original Medicare, and these are the two things that are covered in the 1965 Medicare Enabling Act that Rabbi Siegel mentioned. The first is hospital insurance. What's hospital insurance? It means you're under the hospital's roof and you're eating the hospital's jello. It covers inpatient care. It covers things like care in a skilled nursing facility. It also covers home health care and hospice care. Then there's Part B. Part B is medical insurance, but it's also known as outpatient insurance. It covers visits to the doctors or your specialists. It covers lab work, x-rays, MRI, CAT scans, and even durable medical equipment like a CPAP machine. Then it also covers a Medicare wellness check, which is similar to an annual physical, but not exactly analogous. And it also covers preventative screenings. Then, of course, you're wondering, well, all of this sounds good, but how is any of this paid for? Well, Part A is typically fully prepaid. It's because you paid into it before you turned age 65. So it's something that Uncle Sam owes to you. So you paid into that for many years. If you paid into it for more than 10 years, then there's no charge for you when you start your Part A. And if you've been married to someone who's paid into it for more than 10 years, then the same applies to you. Part B is where it gets interesting though. In Part B, many people don't know that you actually have to pay your premiums to the government to get your Part B coverage. It's not covered 100% by your taxes. It's in fact a bill that comes from Medicare. So Part B premiums are owed directly to Uncle Sam, and they're deducted from your Social Security if you're taking Social Security. And if you aren't if you aren't taking Social Security yet, let's say you're choosing to wait, then you're going to receive a bill for the Center for Medicare Services. And it's usually set at a quarterly pay schedule. And I'll talk about that later on. So that's what your Medicare covers, two parts, hospital, medical. What does it not cover? This is the C subpoint. It doesn't cover two big things. The first is it doesn't provide a cap on your medical expenses. In fact, there's no limit to your exposure for Part B medical services. So if you have a knee replacement, my mom has had two, there's no cap on how much your 20% share of that knee replacement is. So if a knee replacement costs $30,000 and you only have original Medicare, then you're responsible for $6,000 out of pocket. And if you have two new knee replacements at $30,000 a pop, then it's $12,000 total. And there's no cap. That 20% can just keep going up and up, no limit. The second thing that Medicare doesn't cover, the second biggie, is long-term care. What is long-term care? Well, these are things that you might have trouble with, and they're defined by the activities of daily living. They're typically defined by insurers, and they include the following: bathing, dressing, eating, transferring, which means being able to walk from place to place or to move yourself from your bed to your wheelchair, and continence, which is your ability to control your bladder. If you need care to assist with any of these vital activities, it's not going to come through your Medicare. This is one of the largest misconceptions around Medicare, that Medicare covers long-term care. It doesn't. In fact, there have been proposals sometimes discussed in Congress to include a long-term care component, but so far the proposals haven't advanced out of committee because it would be very expensive for the government to cover long-term care. And so far, no one has come up with a proposal to pay for it, but perhaps it'll be in the next stimulus. Then finally, and that was tongue in cheek. Finally, it's hard without an audience on Zoom. I can't hear your reactions. Then finally, what does your Medicare look like? Well, Your Medicare is a red, white, and blue card with 3 components on the front of it. The first is your Medicare beneficiary ID. This used to be your Social Security. It's no longer your Social Security. It's in fact a string of characters. I think it's 13 letters, but I should double check that. And it includes 2 dates on it, your Part A date and your Part B date. For some of you, these dates are going to match if you choose to start your Medicare when you turn 65. And for others, they're going to be different if you stay on your work provided insurance, for example. And I'll cover that a little bit later on. And then this is the front of your Medicare card, well, John Smith's Medicare card. On the back of the Medicare card, it's going to say, you're going to see the CMS logo, the Center for Medicare Services. And that's who you receive mail from about your Medicare. And you also receive mail about Medicare from the Social Security Administration. So if you receive a letter from CMS, it's not junk mail. It's in fact an official mailing from Uncle Sam, and you'll want to pay close attention to it. And something that my team and I have fun with is our clients will send us pictures of the mailings that they receive and ask us if it's junk or official mailings. And that's something that we just enjoy doing because there's some real people trying to pose as the government, and they're imposters. They're not actually official mailings, but they sound really scary. And if it's in fact not from Medicare or from CMS or from Social Security, then we love helping our clients expose that actually it's junk mail. Now that I've covered the who, what, and how, I want to introduce you to two members from your community, Ronald and Linda. Their journey had 3 steps to it, and I think you'll see that they apply to you as well. But first, I want to give you a little bit of background on who Ronald and Linda are. Ronald just turned 65 this month, and Linda is 67 years old. Ronald's retired, and Linda's currently working and has work-provided health insurance. Ronald lives on a fixed income, and Linda has money set aside for retirement. And finally, Ronald leads an active lifestyle, let's say in and around Chicago. And Linda likes to travel. She wants to travel as much as she can once she's retired. So what are the 3 stages we took Ronald and Linda on? First, we helped them we helped them enroll, the word is enrollment, in original Medicare. Second, they considered additional coverage. That's because, as you know by now, Medicare doesn't cover all of the costs or all of the care that you'll need. Third, once they decided what type of additional coverage they needed, the question is which plan to choose. Don't worry, I'm going to walk you through each of these stages so that you understand them and feel confident about the choices that you have available. So part 1, enrolling in original Medicare. Here's how this applied to Ronald and Linda's Part A decision. Well, Ronald and Linda both signed up for Medicare as soon as they were eligible. The reason is because both of them had already paid into the system, so there was no reason not to start their Part A not to start their Part A hospital insurance. Now, there is an exception here, and the exception is if you're on a high deductible health insurance plan and you contribute to a health savings account. So if your deductible is $4,000, $5,000, $6,000, many people have these plans now, and you also contribute to a health savings account as opposed to a flexible savings account, then you'll likely want to not start your Part A. The reason is because you will be fined. You will have to pay an extra tax for the contribution to your health savings account. Whereas if you don't start your Part A, then it's considered non-taxable. So that's an exception. If you have a high deductible health insurance plan and you contribute to an HSA, then reach out to me afterwards because the rules are more complicated here. But if that doesn't apply to you, then you should probably start your Part A when you turn 65. Now, what about their Part B decision? Well, Ronald's case is straightforward. He retired at age 63, so he was ready to start using his Medicare as soon as he was eligible. So that was, in this case, the start of this month. And Linda's decision was more involved. And I'm going to walk you through Linda's decision, but essentially Linda wanted to assess whether Medicare insurance would be superior to her work coverage. And you'll see that Linda, just because she didn't sign up when Ronald signed up, is going to get a special enrollment period, but I'll cover that in a moment. For Linda's decision, and this is why would Linda choose to start her Medicare rather than remain on her employer-based coverage? Well, her decision really depends on the cost and the quality of her employer-based coverage. These plans vary widely between companies, from the premium that you pay for the plan itself, from having a spousal contribution if your spouse is also on your work-provided coverage, to what in fact is covered by your work coverage, whether there's no deductible or a very high deductible. So to help you make this assessment, the chapter team built the Part B calculator to weigh the costs and the benefits of staying on your work-provided coverage as opposed to starting your Medicare Part B. And it's just a list of questions to help guide your decision-making. And the calculator takes a great deal of information into account in order to make its recommendation, including ultimately what premium you'll owe if you choose to start your Medicare. And if you'd like me to send you the Part B calculator, again, just drop something in the chat so that I know to reach out to you after the presentation. But it's on our website, getchapter.com. So what is a major thing that the Part B calculator takes into account is what's called your Part B IRMAA. What's your Part B IRMAA? It stands for Medicare Income Related Monthly Adjustment Amount. It's a mouthful, but its acronym is IRMAA. And that's the amount that you may pay in addition to your Part B or your Part D premium if your income is above a certain level. And don't worry about Part D premium, because the Part B is the big amount that you would owe if you make, for example, above $88,000 solo, and if you file jointly above $176,000. But because that might apply to some of you, I just put the additional assessment that you would owe. So about 85% of people are in line one, that is that they make $88,000 or less on their individual return, and $176,000 if they file jointly. The amount for Part B then is $148.50. But you can see if you make more than that, then it goes up in graduated categories. And these are defined by Social Security, by the Social Security Administration. That's the government entity that sets the income brackets that determine yours and your spouse's IRMAA. And they're listed on this chart so that you can see if they apply to you. And many people typically have questions here. And again, if you want to discuss in private exactly how much you'll owe for Part B and Part D as part of your IRMAA, then please reach out to me after the presentation, and I can tell you exactly what you can expect to receive in the mail from the Center for Medicare Services. Now, I want to go into further detail about when you can sign up for Medicare. First, I want to address people like Ronald who are signing up by virtue of turning 65. When can someone like Ronald sign up for Part A and Part B because they want to start their Medicare as soon as they're eligible? Well, clients turning 65 have a 7-month period. It's called their initial enrollment period. And the window starts 3 months before their 65th birthday, and it extends to 3 months after their 65th birthday. So how did this, it's 3 months before, the month in which your 65th birthday takes place, and then 3 months after. So Ronald's birthday was at the beginning of this month. How did that apply to him? Specifically, his birthday was April 2nd. If his birthday were April 1st, he actually would get to sign up a month early. So that's something cool. I have a birthday on the 1st. If you also have a birthday on the 1st of the month, you get Medicare a month early. So that might be why Medicare has always intrigued me. But for Ronald, his birthday was on April 2nd. So his initial enrollment period started January 1st. And his period will extend all the way to June 30th. So if Ronald delayed, then he could notify Social Security as late as June 30th that he wants to exercise and enroll in original Medicare. Now, what about Linda? I mentioned a special enrollment period. Well, if Linda decides to leave her work-provided coverage, then she's already 67, so she's not eligible for the age-in window that Ronald used to start his Medicare. How is Linda going to sign up for Medicare? Well, she's going to have a special enrollment period. And because Linda will be losing her group health coverage, and this is critical, her employer has more than 20 employees, which makes it a large group employer for the purpose of determining Medicare, then she'll actually receive an 8-month window to sign up for her Part B coverage. Remember, Linda started her Part A when she turned 65, but if she chooses to leave her work-provided coverage when she turns 67, then that'll start an 8-month window to sign up for Medicare. And if your situation is similar to Linda, then keep this in mind. Linda and people who are still receiving employer health coverage, there is an 8-month window, but there are other constraints that control the decision. For example, if you wait until the end of that 8-month period, then your work coverage terminated at the beginning of the enrollment period. So you've been without coverage for 8 months at that point. To make a seamless transition, you want to make sure that you notify Social Security in advance of your retirement date. Otherwise, you're going to have a gap in your coverage, and you don't want that. And then, as you'll see at the bottom of this slide, you also might need to sign up sooner if you want Part D drug coverage, which is something that I'll discuss in a bit, but many people want it. There's a penalty if you don't have it. It's about 35 cents a month, but it can actually add up, and it's a lifetime penalty. So you definitely want to make sure that your Part B date coincides with your retirement date, whenever that is. So normally I recommend that people start thinking about their Medicare 3 to 6 months before they actually choose to sign off from their work provided coverage. And that's something that we can help you with and have a lot of experience dealing with human resources in what documentation you need in order to submit to Medicare. So what does Medicare, I already addressed what, pardon, I already addressed hospital and medical coverage, but I also want to address what you get for your Part B when you start your Medicare. Your Medicare only covers 80% of your Part B costs. It still leaves you responsible for paying at least 20% of most of your medical costs. And that's something I mentioned earlier, but I just want to reiterate that Part B premium that you pay to Uncle Sam only covers 80% of your medical costs. That leaves you with 20% remainder with no lifetime cap. Your medical costs doesn't include the following. It doesn't include things like your prescriptions. That's Part D, which is something else. It doesn't include eyes or eye vision, corrective lenses, contacts, for example. It doesn't include dental, and it doesn't include hearing. So for people for people who want these types of additional coverage, note that your Part B will not cover either of these 4 categories of costs, but you definitely want to be thinking about them as you approach your retirement, because when people realize that there's a whole category of costs that traditional Medicare doesn't cover, it's the #1 thing that motivates people to think about purchasing additional coverage. And it's typically when we meet people because they realize that there might be gaps that they want to correct. So that's why I want you to be aware of the gaps that are part of your Medicare so that you're not left holding a big bill that you thought your Medicare was going to pay for. So with that, I want to walk you through step 2 of the Medicare journey, which is what to do about that 20% gap that traditional Medicare doesn't cover and how to assess additional coverage options. Now that we all understand that many people would benefit from additional coverage because Medicare doesn't cover all of your costs, let me talk you through 2 types of comprehensive coverage, and you can choose which option is right for you. And I'm going to show you which ones Ronald and Linda chose, but they each made different decisions. So option 1 is to keep, my voice cracked. Option 1 is to keep your additional coverage, to keep your original Medicare, and to then add a Medicare supplement plan. You've probably heard of these. Medicare supplement is also sometimes referred to as Medigap. That's because it sits on top of your original Medicare. So the way it works is Medicare covers the first 80% of your medical costs, and then the remaining 20% is forwarded on to your Medigap insurer. And you see many major insurance companies offer Medigap, companies like United Healthcare, Aetna, Humana. So there's a lot of competition in this market. Then, in order to cover their prescriptions, because Medigap doesn't cover one's prescriptions, people typically add a Medicare Part D plan, which costs anywhere from about $7 to $25, depending on the prescriptions that you take. And also note your prescriptions change every year, and your prescription plans change. Too. And the time in which to change your prescription plan is the fall, but I'll cover that in a bit. The second way to achieve comprehensive coverage is something called Medicare Advantage. Medicare Advantage, also known as Part C, is a complete replacement for original Medicare. It's administered through private insurers rather than through Uncle Sam. So companies here step in to provide your Part A and your Part B benefit. Now, these provide the hospital inpatient and the medical services outpatient that you would have expected from traditional Medicare. However, you are limited to the insurance carrier's network. These plans are attractive because sometimes they have lower premiums and they also come with additional benefits, and many cover prescription drugs, but I'll recap this for you on the coming slides. So let's apply this to Ronald. Ronald's goal was to minimize his monthly premium payments. What do you think Ronald chose? Well, Ronald decided that a Medicare Advantage plan was right for him. He loved that it was all-in-one coverage. He didn't mind network restrictions on which doctors he could see. All his doctors were in one network. He only had one specialist and a primary provider. And he loved the additional benefits that the Advantage plan offered, things like dental care and also, things like dental care. And also the plan that Ronald selected even had a Part B give back, which helps pay down the costs of starting one's Medicare. So here are things that you should know about Medicare Advantage. First, there are low premiums, sometimes as low as $0 per month. And they're the most inexpensive types of additional Medicare coverage. And that's because the government is paying for it and not you. Second, many of these plans include some type of prescription coverage. Whereas if you don't go the Medicare Advantage route, you will have to pay for a standalone prescription drug plan, which can cost usually around $7 to $25 per month. Third, Medicare Advantage plans typically have a predefined network of healthcare providers. This helps them achieve lower costs, but at the same time, it's restrictive and it limits your flexibility. And then finally, there are additional benefits that are offered, things like dental, hearing, vision, and some even offer gym memberships like a Silver Sneakers. Some say this sounds great. Can I have both? Can I have both a Medigap plan so I have the flexibility and the ability to go to doctors across the United States, anyone who accepts Medicare? Others ask, I also want the additional benefits. Why not both? You can't have both. It's one or the other. So if you choose Medicare Advantage, that's a complete replacement for original Medicare, and you aren't able to get a Medigap plan. What about Linda? Well, for Linda, she wasn't as concerned about premiums cost as Ronald. Her priority was to see any doctor who accepts Medicare with no network restrictions. So Linda chose a Medigap plan for her health coverage, and I'll discuss how Linda achieved prescription drug coverage in a moment. But here's what you should know about a Medigap plan. The first is you can see any doctor who accepts traditional Medicare. 98% of doctors across the United States accept traditional Medicare, and the ones who don't normally are involved with children. They're pediatric doctors. The second thing is there's an initial guaranteed issue window for the first 6 months of your Part B enrollment to sign up for a Medigap plan without being subject to underwriting. And what that means is you can't be denied if you're in your initial guaranteed issue window. The other thing is you still must pay a premium. This is true of both Medicare Advantage and Medigap plans. You still pay your Part B premium to Uncle Sam. And finally, you can't have both a Medigap plan and a Medicare Advantage plan. So what is guaranteed issue? I want to cover this a little bit more in depth as it applies to Illinois law. What guaranteed issue means is that an insurance carrier must sell you a Medigap policy. They can't pick and choose which conditions they cover. It must cover all of your pre-existing health conditions. They have to accept you as you are. And the best part is they can't charge you a different price in order to do that. You can't be nicked because of previous health problems, and they can't assess your current health condition if you're operating within the first 6 months of your guaranteed issue window. And in Illinois, you have an initial guaranteed issue right within the first 6 months of starting your Part B coverage. So Linda was still able to get a Medigap plan, even though she was 67 years old, because she was in her initial guaranteed issue right. So here's a student question. Thank you for emailing this in beforehand. What is the screening medical assessment process for determining if a Medigap plan will allow you to enroll after you have been on an Advantage plan? And the answer here is that you'll have to go through, if you've been on an Advantage plan for less than a year, then you have a trial right, and you probably will be able to switch to a Medigap plan with guaranteed issue. However, if you're past the year-long window, at least as it applies to the state of Illinois, you'll be asked underwriting questions, which means that the carrier gets to ask you questions about your previous health history and any chronic conditions that you have. So it's very important, if you're leaning towards Medigap, to be aware of the guaranteed issue window, because it's a big deal to be able to be approved, to not, for the carrier to not be able to deny you in order to get your coverage. Now, I want to cover how Linda was able to get comprehensive coverage for her prescriptions. So Linda chose Medigap. How was she able to add prescription drugs? She purchased a standalone Part D prescription drug plan. And here's what you should know about a Part D prescription plan. The first is that it's coverage for your prescription drugs. It's partly paid for the government. It's also partly paid for by you. And if you notice, if you earn a lot of money, you're not only going to have a Part B assessment, IRMAA, you're also going to have a Part D IRMAA. So that's important to keep in mind. That said, the Part D IRMAA is much less than the Part B IRMAAs, which you noticed might have been, they're in the hundreds of dollars. For Part D, the very highest IRMAA is about $77 for 2021. The reason to get Part D coverage, whether it's through a Medigap plan or through a Medicare Advantage plan, is that it's highly recommended. You're actually penalized if you don't get it. It's a lifetime penalty, so you definitely want to make sure that you get some way to cover your prescriptions. There are two ways that you can get it. The first is through a standalone Part D plan like Linda, and the second is as part of a Medicare Advantage plan like Ronald. Now it's time for the final step of your journey, and this is what we helped Ronald and Linda with. Now that we know what type of coverage they wanted, Linda Medigap plus Part D, Ronald Medicare Advantage, which includes prescription coverage, it was time to help them select specific plans. And you'll note that they made different choices, but what is interesting is that in Cook County, you have so many choices. And it's a good thing, but it's also a curse, because it means that you have a lot of work to evaluate. For example, there's 46 different options for Medigap if you're interested in Medigap, and there's actually 54 options. I searched by zip code. So this isn't, I didn't want to combine plans that were offered in multiple zip codes. So this is just looking at Cook County in aggregate. There are actually 54 options for Medicare Advantage. So what are the differences between these plan options in Cook County? Well, the first is that all plans have different premiums. For Medigap, it can be in the hundreds of dollars, depending on when you start your Medigap, or if you're, for example, you're rated by the carrier. And for Medicare Advantage, some of the plans are as low as $0. They also differ along other factors, like the benefits that are offered. As you know, Medicare Advantage has additional benefits like dental, vision, and hearing. They also vary along the deductibles and copays. Each time you use your Medicare Advantage plan, there's typically a cost to using it. There's a cost when you see a specialist. But with a Medigap plan, there are two different types of Medigap plans that we commonly recommend. And the one that is the most common choice, Plan G, doesn't allow copays. All of your costs are forwarded on to the Medigap insurer. And then these plans also differ along the out-of-pocket maximums that you can pay. It's not relevant if you're choosing a Medigap plan that covers 100% of your medical costs, but it is relevant with Medicare Advantage because, for example, if you're out of network on your Medicare Advantage plan, then you can be charged up to $11,300 for the year 2021. And then finally, they also differ along physician networks. With Medigap, this isn't a concern because you can see any doctor who accepts original Medicare. But for Medicare Advantage, it's a big concern because carriers like Blue Cross Blue Shield or United Healthcare, for example, form networks of doctors, and you can only go in network if you want to achieve maximum cost savings by using your Medicare Advantage plan. So this is typically the factors that we see our clients choose based on. The first is cost, whether they're very premium sensitive or whether they don't use very much care and are okay deferring those costs until they actually use their plan. Then you're probably looking at a Medicare Advantage plan. The second factor that our clients consider is doctors and networks, whether they're comfortable with restrictions on the doctors they can see, or they want maximum flexibility. The third is prescription drug coverage, whether they want it included as part of their plan, or whether they're okay buying a standalone Part D prescription plan for clients like Linda. And then finally is location and lifestyle preferences. If you like to travel, then you want as wide a group, then you want to be able to see any doctor who accepts original Medicare rather than having restrictions on which doctors you can see. The reason is because Medicare Advantage plans typically have a radius of about 50 miles. And if you're outside your network, then you won't be able, then your plan will actually impose punitive out-of-network costs, or you might be, or the plan might cancel you, in which case you need to choose a different plan. So I want to go over what changes each year across plans and why it's important to have a Medicare checkup. What changes is that the premium and costs vary, the benefits vary, and the physician networks vary. And so this is why if you choose a Medicare Advantage plan, it's important to have a checkup each year. And of course, if you have a Medigap plan, then you'll want to you'll typically, in almost all cases, want to also have standalone Part D prescription coverage, and that varies as well. And a good time to reconfirm your coverage each year is the annual enrollment period in the fall. And note that if you do have a Medicare Advantage plan at the moment, Illinois has a special enrollment period, which allows you to make changes through May. So keep that in mind. Even if you miss the opportunity to optimize your Medicare Advantage plan, Illinois, due to COVID-19, has actually extended that window to the end of May. And this is where it can really help to work with an advisor. Chapter is one that can look at your plan, ask what factors are most important to you, and then help you prioritize which plans to choose. So now I want to go over the top 5 Medicare misconceptions that I've seen my clients make, the mistakes that are sometimes costly, and I'm sharing them with you in order to help you avoid them. And I'm going to share this presentation afterwards. So please put your emails in so that I have it and can send you the presentation. So if you missed anything along the way, then I can share it with you by email and we can stay connected. So the first misconception is that traditional Medicare covers all medical costs for beneficiaries. You know this isn't true by now. You know that Medicare only covers 80% of your medical costs. The other 20% are yours, and you need to pay them with no cap if you just have original Medicare. The second misconception is that Medicare coverage is automatic when you turn 65. Look at a client like Linda, for example. She was on her work provided coverage. It's not automatic. It's actually something that you need to notify Social Security that you want to start, whether you're in Ronald's shoes or Linda's. And we actually have a tutorial. I have a tutorial, a video tutorial on our website that you can use to sign up for your Medicare. And I walk you through exactly how to navigate the Social Security Administration website and what documentation you'll need along the way. And we find the clients really prefer it because then they don't need to wait on hold to speak to someone at Social Security, and instead they can submit online. The third misconception is that it doesn't matter when you sign up for Medicare. By now, you know that there are penalties if you don't if you aren't following the rules for when you are supposed to sign up for Medicare. In fact, let me show you just how punitive these penalties can be. If you wait to sign up for your Part B and are without coverage, then you'll pay a 10% penalty on top of your Part B premium for every full year that you wait to sign up. So I've seen people who owe hundreds of dollars in penalties because they waited until age 72 or 73 to sign up for Medicare. There's also a Part D penalty, and that Part D penalty is 1% of the average, which is about it comes out to about 35 cents per month. But it's annoying to have to write a check to Uncle Sam each month, even if you only miss a month, for 35 cents. And it is something that it'll go the rest of your life. There's no way to, there's only a way to mitigate the damage. There's no way to actually reverse it. And this is just an example. At the bottom, you can see someone who waited about 5 years to sign up for Part B owes an additional 40% penalty, and they owe for each month after the first 63 days as a Part D penalty. So those 35-cent months add up. And that's at the bottom of the table. But again, don't worry, I'm sending these slides to you if you leave your email address. And again, these are lifetime penalties. The bigger, they get bigger the longer that you wait. So if you are subject to these, then don't worry, I've helped clients mitigate the damage from them. But if you haven't started your Medicare yet, then just be mindful that these penalties exist. So please stay on top of your deadlines, and it's something that Chapter can help you with. And we actually send email reminders all the time so that our clients don't miss these windows and end up owing penalties. The fourth misconception is that your neighbor's Medicare coverage is a good plan for you. Well, it's not something you really ask your rabbi or your neighbor. Here are the factors that you might consider individually, but see if your neighbor's factors would apply to you. First, does your neighbor have the same cost preferences that you do? Are they more willing to bet on their health than you are? Then if they are more willing to bet, perhaps they should consider a Medicare Advantage plan. But if you don't want to take that risk into account and you prefer the upfront certainty, then you would probably be pointed towards a Medigap plan. The second factor to consider is doctors and networks. You likely don't see the same doctors as your neighbor, and therefore you have a different choice to make. The third is your prescription coverage, what prescriptions you're on, how those prescriptions are covered, and which pharmacies you like to go to. And then finally, your location and lifestyle preferences. Things are opening up again, and as they do, many people will want to travel. If you want to travel, you'll have restrictions with a Medicare Advantage plan, usually. But with a Medigap plan, you can see any doctor in the United States, whether they're in Illinois, Florida, or Hawaii. As long as they accept original Medicare, you're good. The final misconception is that you only need to choose additional Medicare coverage once. By now, you know that this is something that you need to check up and reconfirm each and every year. In fact, we recommend that the best time to do this is in the fall. It's coming up. But if you haven't done it yet, I'd be happy to walk you through exactly what your options are based on the doctors that you see, the prescriptions that you take, and what you're comfortable with paying, and also the benefits that you'd like to achieve, be it full 100% coverage, unlimited flexibility, or vision, hearing, dental, which is something that you can only achieve through a Medicare Advantage plan. Otherwise, you're looking at some type of standalone supplemental coverage. And this is something, again, that an advisor can help you do. Chapter is one of them. Feel free to explore the resources that we have. There is no charge for our services. It's something that we've helped thousands of people navigate each year. So with that, I just want to recap the misconceptions. The first is traditional Medicare doesn't cover all your medical costs. The second is that it's not automatic when you turn 65. It's something that you have to notify Social Security about. The third is that it really matters when you sign up. I don't want you to be subject to penalty. Your neighbor's coverage may or may not, probably not, be the best choice for you because the factors that you're deciding on are different than your neighbor's. And finally, it's something that you should check up on and reconfirm each year. And so with that, I can see that there are many questions. So I want to leave you with my email address, ari@getchapter.com, and my direct phone number. And I hope to hear from you. And I'm also open to your questions now. So please let me know what's on your mind and what questions you have about your Medicare.
If you could get the stop screen, Ari, that may help us.
Oh. Great.
There you go. Because there were a lot of questions that were in the chat.
Awesome. And I'm sorry, Scott, I asked you to unmute. It was totally by accident. I have large fingers.
That's okay.
Actually, I believe Scott had a question about whether or not Medicare was good out of the country. Is that correct, Scott?
Yes, but I think he answered that.
Yeah.
I want to answer it in a little, it's a great question. I want to answer it in a little more detail. Original Medicare is usually not. It is very limited coverage across the border in Canada and in Mexico. It's very limited. However, Medigap provides 80% coverage when abroad in the event of an emergency for the first 60 days, which is very useful. Medicare Advantage typically has no coverage when abroad, but there are some plans with worldwide emergency care benefits. That said, if you plan to travel abroad and you want your Medicare to cover you, I would typically point you towards a Medigap plan. And I would also encourage you to consider supplemental travel insurance, because if you need a medevac, for example, then 20% of a medevac, I cannot understate just how expensive that can get. It's in the tens, if not low hundreds of thousands of dollars.
Sometimes millions.
I
It can be millions.
believe you.
So there were other questions about plan supplement that cover, is there a plan supplement that covers all costs other than the premiums?
Yes, that would be a Medigap Plan G, as in George. I think I'm understanding the question correct. The only thing a Plan G, which this is Medigap Plan G, Medicare Supplement Plan G. The only thing a Medigap Plan G doesn't cover is the $203 Part B annual deductible. So there's a very small deductible, and that's assessed by Medicare. It's $203. That's the only thing that Plan G doesn't cover. Now, if I can get on my soapbox for a moment, there used to be what's called a Plan F, as in Frank, and some of you might have it. It still exists, but that plan covers the $203 Part B deductible. That said, insurance carriers are charging a lot more than $203 to remain on that coverage. So what we typically find is that it's better to choose to switch to a Plan G if you can pass underwriting, because you'll save hundreds, if not thousands of dollars a year, since Congress kiboshed that plan in 2015, and it actually sunset for new enrollees as of January 1st, 2020.
Another question was whether or not the coverage covers concierge doctors.
Concierge care is not covered.
I'm going through the questions on the chat, so bear with me.
Of course. And I'm noting some questions I saw while I was presenting. I mean, some of you asked very funny questions. David Simon, I have to take a question from my father-in-law. Is there a plan supplement that, you asked that question. Thank you, Amy. From Lisa Friedstein, if you change the Medicare Advantage, can you go back to Medicare? Yes, you can. There is a trial window. In Illinois, it is 12 months in Illinois. And you can actually switch from your Medicare Advantage plan to a Medigap plan so that you can get a guaranteed issue window, but it has to be in the first 12 months that you have that Medicare Advantage plan. If you have it for 1 month longer, let's say 13 months, you're going to have to go through medical underwriting to switch to a Medigap plan. Great question.
Yeah, Elise had a question on the 1040, whether it was adjusted gross income or if it was taxable income.
It's the top line. It's your taxable income. Oh, wait, hold on. The top line would be adjusted gross, I believe. But I will double check and confirm by email, but it is the top line. I'm sure of that. And then from Scott and Marcy, are you covered if you travel? Oh, you asked that question. Thank you. Yeah. From Sheila, how would I make an appointment to see you to review plans? Sheila, I just reach out to me afterwards and we can set something up by email or by phone. Would love to speak with you. And from Elise, does Chapter charge a fee for their service? There's no charge to work with us. And just no. However, if you choose a plan, we are compensated by the insurance carrier based on the plan that you choose. That said, every insurance carrier pays commission, and the commissions don't vary between carriers that much, and it doesn't influence the recommendation at all. Are there other questions, Amy?
Not that I see. Not that I see. If anybody has additional questions, you can either unmute yourself or type it into the chat so we can see it.
I have a question. If a doctor's office does not accept Medicare, I assume that means Medigap is useless, but I wanted to verify that. In other words, if a doctor doesn't take Medicare, unless you want to pay everything out of pocket, you've got to switch doctors once you become Medicare eligible. Is that correct?
Mm-hmm. This is a point of complication. And your answer is quite technical, so I want to give a technical response. There's two things that you might mean when a doctor doesn't accept Medicare. It means that they don't, this would be exceedingly rare, because 93 to 98% of doctors across the US accept original Medicare. But what it might mean is that they've just opted out entirely. Concierge medicine would be an example of that. That means that's right, you're going to pay that full bill out of pocket. The second thing you might be referring to, though, is that they don't accept the Medicare assigned amount. And if that's the case, there's still a way to get reimbursed for your claim. It's just a little bit more involved, and it involves a bit of paperwork. And it's something that I can help you with and that the chapter team has great familiarity with.
My understanding is that it's fairly common among gynecologists to not accept Medicare. And when they say, here's the insurance plans we take, and we don't take Medicare, I assume that means they just have opted themselves out of Medicare altogether. I don't know if that's something you've come up with, but that's a fact I recently learned from an internist who said to be careful when I start looking around.
But most obstetricians do.
Very helpful, David, for those of us in our 60s to have obstetricians.
I would point you towards the provider search tool on our website. You can enter in the gynecologist that you're interested in, and you can see right there if they accept original Medicare or not.
Okay.
And if you'd like to give me their name, I can look them up doctor by doctor. It's a technology we've implemented, and it's very useful. I use it every single day for many clients. I look up their specific doctors and I see whether they accept original Medicare or not.
Okay, and can you also repeat your phone number, because you took this slide down before many of us got it?
Oh, sure. My number is 815-369-0688.
Okay, thank you.
There's a couple of
Showing
additional
me that he was
questions.
faster than I was.
From Scooter, is this all individual, meaning no spousal or dependent coverage? That's right. Medicare is it's the libertarian fantasy. It is purely individual coverage, which means it does not cover your spouse or your dependent. If your spouse is turning 65, then they get their own Medicare card and they need to choose their own Medigap or Medicare Advantage plan if they want additional coverage. Yours is yours alone.
Scott and Marcy have another question. Can you see it, Ari?
I see their question. If let me read it to everyone. We are both 64, or it's a hypothetical, but we are both 64, and one member of the couple is turning 65 in December, and we have a health savings account. Can we contribute to the HSA this year? If so, the full amount. I would need to look into that. It might go month to month. It might be the full year. It might be advisable to wait until January in order to avoid being hit with a penalty. And I would also say that it's something we can also talk about what you would do to avoid a gap in your coverage, whether that be COBRA or an Affordable Care Act option that we can help you with. And just keep in mind too, sometimes your Part A date is backdated 6 months. So that means you should stop contributing 6 months in advance of your Part A date if Scott and Marcy's situation applies to you. But again, this is a very rare situation. And of course, it's great that we have these types of technical questions, but this is a very rare situation where someone has a high deductible health plan and they're also contributing to a health savings account. And Scott and Marcy, I'll back channel with you afterwards so we can address your situation in depth.
There's a question from Abe
Pam.
Steinberg.
Oh, okay. Let me read it. What features other than cost differentiate Medigap coverage? Is this, Abe, is this between different Medigap plans, or is this between Medigap and just original Medicare?
Well, if you look at the benefits, like let's say like transfusion, they'll say one guy pays 193, one pays 203, but realistically, you're not getting a lot of transfusions. These are really trivial or very uncommon issues. I mean, are there anything that you really want to hone in on and say like, well, this one covers the durable medical equipment 100%, but this one, you know, whatever.
Blood transfusion is really interesting. It's actually a Part A hospital benefit, not a Part B benefit. For Part B, it's different by plan type, and the premiums, for your question, as for Medigap, it's different by plan type. So Plan G is the best coverage you can purchase for Medigap. Plan N is very similar to Plan G with 3 differences. I don't need to get into them now, but there are 3 minor differences from a Plan G to a Plan N. That said, we find that if people want the most comprehensive coverage, they typically choose Plan G because the premium savings for a Plan N are quite small. Go ahead.
So, I mean, if you're shopping between 2 companies, I mean, some things are really not important. I would say transfusion is not, because it's not as common, but something like durable medical equipment might be more common. And is this like we'd hone in on for the benefit for that, as opposed to, just
Got
ignore the transfusion stuff and just all these other things they differentiate.
Got it. This is really important. Any Plan G by law must do the same thing as any other Plan G. So Aetna doesn't get to pick and choose which Part B costs they're going to cover as compared to United Healthcare. They must do the same thing, cover the same set of services. So the only difference is the price and the credit rating of the carrier.
Okay.
And if you want more information about what the prices and the credit ratings are, you can use our tool because we rank those we list those factors. It's public information and we've compiled it for you. Lisa asks, should be, I know Joe Namath does Medicare advertisements. I'm not sure which company he advertises for. That said, I think Joe Namath is shilling for Medicare Advantage plans. It really depends whether Joe Namath's Medicare Advantage plan, if your doctors, your prescriptions are covered by that plan, whether I would recommend it for you. So I would trust but verify Joe Namath's recommendations.
Above
Pam,
Lisa's question, Pam has one.
Pam asks, if you want to change, hi Pam, if you want to change your Medicare plan, but it's not the open enrollment period, can you still modify your plan or do you have to wait? There are 2 situations that this could pertain to. So if you have if you just have original Medicare, you can sign up for a Medigap plan at any time during the year. The windows that you see advertised on television typically are about Medicare Advantage. They're not about Medigap. If you only have a prescription drug plan and you want to change your, if you have a standalone Part D prescription drug plan and you want to change your Part D plan, your window is in the fall to do that unless a special circumstance applies, like your carrier went belly up. If your carrier went belly up, very rare, but it actually happened in Illinois last week with Indy Health, all their clients were transferred to Humana. And so people who were transferred from Indy Health to Humana actually had a special enrollment period to move away from Humana. So that's why credit ratings are important. Carriers do go belly up. And then what Pam's question also could refer to is if you have a Medicare Advantage plan. With a Medicare Advantage plan, you have a special enrollment period right now through the end of May. If you miss that period because it's now June, let's say, then you're going to have to wait until the fall to make any changes. All right. With that, I want to hand it over. These are great questions. I could go for hours, but you have my email information, Ari@GetChapter. Thank you to everyone who dropped their name and email in the chat. And my phone number is 815-369-0688. And with that, I want to turn it over to Amy. And again, share my appreciation and gratitude towards Anshe for putting on the event tonight and for just having a great community where we can be together, even in the midst of a pandemic.
Well, I want to thank you, Ari, for bringing this to the attention of Anshe Emet. We were happy to host it on your behalf, and it was a pleasure. And I know it was very informative for me as well, since I'm in the same age category getting ready. If anybody has additional questions or wants to reach out, I will send an email out tomorrow listing Ari's contact information again. And Ari, there were some people who had signed up but did not make it onto it tonight. So please let me know how you'd like me to handle that group that wanted it recorded, which we are recording it, or if you want to send the information to them.
I'd be happy to share the recording.
Okay, great. So on that note, again, thank you, Ari, and thank you, everybody. I hope everybody has a great night and stay safe, stay healthy, And let's all sign up for Medicare soon.
Baruch Hashem.
Baruch Hashem. Thank you, everybody. Have a great night.
Amy, I
Yes, I'm gonna
noticed some
stop recording.
I noticed some direct messages